government to build isolation centers in border communities as coronavirus cases rise to 373.
COVID-19 in neighboring states is of great concern. Although the borders are closed and there's supposed to be no movement, when Nigerian citizens turn up, they are allowed in.
President Muhammadu Buhari meets National Assembly leadership on strategies towards controlling and containing COVID-19.
European Union donates 50 million euros to support Nigeria's coronavirus efforts.
This brotherly support will save millions of lives. Nigeria will remain grateful for generations to come.
And on Good Morning Nigeria this Wednesday, we shall discuss COVID-19 essential workers.
There is no compensation in short. Each day I leave my home to be in the office, I don't always get myself because I'm always thinking of how my family will be coping and I'm endangering myself.
There is a video currently trending on the social media and made by an emergency room and intensive care nurse in New York City. Now, the nurse who was crying in the video said she was tired of walking into rooms and finding her patients dead from COVID-19. She wanted to let people know how emotionally draining it was for health workers like herself to be around so many deaths every day.
Well, unfortunately, New York now has the most coronavirus cases in the United States of America, and the death rate is more than any country outside the U.S., including Spain and Italy. Some weeks ago, health workers in Europe also made videos which were trending online, begging people to heed to health workers, our health experts, and government's directive to stay at home and stop going out, spreading coronavirus, and what's still, taking it home to their families.
Well, reinforcing the importance of staying at home during this period, President Muhammadu Buhari has promptly extended the lockdown in the Federal Capital Territory, Lagos and Ogun states for another 2 weeks after the initial 14-day lockdown.
Well, as painful as the lockdown has been for the economy, for the people and the nation, experts say it is necessary for the overall health of the nation. Many states have since closed their boundaries to limit cross-border transmission, even before the index case in Kano, who is reported to have traveled from Lagos despite the stay-at-home directive.
Well, the directive, of course, exempts those who are on essential duties. Healthcare workers, police and fire service staff, road safety officers, journalists, water and electricity providers, environmental sanitation service workers, as well as pharmacies and grocery store owners are recognized as essential workers during this pandemic.
More exemptions on Mr. President's list include commercial establishments like food processing, distribution and retail companies, petroleum distribution and retail entities, and private security companies. So with the restriction on vehicular movement, how are essential workers faring in their duties during the lockdown? And how challenging has this lockdown period been till then?
And Kirian, of course, we shall also find out what kind of challenges essential services workers, such as we have listed, face during the COVID-19 lockdown. What are their own anxieties? All these issues and more we shall, of course, be discussing in our conversation segment today on Good Morning Nigeria, reaching you as always live on the network service of the Nigerian Television Authority. I'm Kingsley Osadolo.
And I am Kirian Umayo. Many thanks for joining us on the program this morning, and as usual, you should be expecting the other segments that will make part of the package, and it includes a newspaper review, business, and others. Right now, we go for the news highlights with Claire Adelabu Razak.
Kieran, thank you. Hello, both of you. It's good to see you staying safe and, of course, maintaining social distance. Let's get on with the early morning news. And as at 11 p.m. on the 14th of April, the NCDC reported 11 new cases of COVID-19 in Lagos alone, and that's after an initial announcement of 19 new cases in Nigeria at 20 minutes past 9 in the evening, out of which Lagos had 14 cases. Now, the 11 new cases in Lagos plus the 19 new cases recorded in 3 states, including the FCT, brings the total number of confirmed cases in Nigeria to 373. There are now 25 new cases in Lagos, 2 in the FCT, 1 each in Kano, Akwa Ibom, and Edo states. 99 patients have also been discharged so far, with 11 deaths. Meanwhile, the federal government is planning to build isolation centers in states that border neighboring countries, considering the rising cases of COVID-19 among Nigeria's neighbors. This was one of the outcomes of Tuesday's briefing by the Presidential Task Force here in Abuja.
Prevalence of COVID-19 in neighboring states is of great concern. Although the borders are closed and there's supposed to be no movement, when Nigerian citizens turn up, they are allowed in. What we do now is to take them to a facility where they can be isolated.
We have now activated a total of 12 labs across the country to bring testing closer to the people.
I've instructed all the commissioners of police, the AIGs in charge of the zonal commands, to deploy all the resources available to them to make sure that criminals are not allowed to take the opportunity of the lockdown to perfect their crimes.
Such a monumental decision has been taken at great pains, and we continue to appeal to Nigerians to show a lot of understanding.
We are appealing to banks to please continue to provide financial services, especially the availability of cash at ATM.
The public was also encouraged to report any security operative involved.
That was the Presidential Task Force on COVID-19 briefing the press. Meanwhile, President Muhammadu Buhari has granted audience to the presiding officers of the National Assembly in furtherance of his strategic engagement with all critical stakeholders towards controlling and containing the coronavirus pandemic in the country. President of the Senate, Ahmed Lawan, who spoke to newsmen after the meeting, maintains that both the executive and the legislature are on the same page regarding efforts at tackling the health challenge and result and impact on the populace.
What is utmost to us is to ensure that Nigerians get succor, get relief, and we will do everything possible to ensure that there is equity, there is fairness, there is justice in the distribution of any support, whether it is a relief package or indeed any support in terms of fighting COVID-19 in the states of the Federation. The President has taken the right decision by approving an additional 1 million families to be included in this social register, and I believe that in the next few weeks the Nigerian people will see a difference in the implementation fully and properly, efficiently and prudently.
The broadcast yesterday was worked well. There were added incentives. What is imperative right now is that when you ask people to stay at home, you must make that home a little bit more comfortable for them. Make sure the light is constant for those 2 months. It's a stimulus. Give it to people free of charge for 2 months, so that they'll be able to stay at home more conveniently. It may be a tough sell, but where there's a will, there's a way.
And the European Union has announced a donation of 50 million euros to Nigeria in support of efforts at containing the coronavirus pandemic. The amount, equivalent to 21 billion naira, is to be channeled through the UN COVID-19 Basket Fund. The European Union ambassador to Nigeria, Ketil Carlson, made this known during a solidarity visit to President Muhammadu Buhari.
Now more than ever, we want to show solidarity with our partners. The EU solidarity with Nigeria at this momentous time will save lives. It will also ensure that we protect the gains of the Sustainable Development Goals while safeguarding the livelihoods of the most vulnerable, especially women and girls.
I'm indeed touched and grateful that the European Union still has the vision and foresight to to remember its friends, partners, and allies across the world. This brotherly support will save millions of lives.
And the first batch of consignment containing essential medical supplies against COVID-19 has been delivered to Nigeria by the United Nations at the Nnamdi Azikiwe International Airport in Abuja.
First shipment that arrived with the Allied cargo today is 50 ventilators and 3,605 kilograms of PPE equipment and materials. The second shipment is expected with thousands of PPEs, and the third shipment is also expected with testing kits.
We'll continue our collaboration with the government, and we also have, as you know, established a basket fund, and part of that will also be commodities. So yes, we expect more support from the United Nations to come.
Meanwhile, more Nigerians have continued to react to Monday's presidential speech on the extension of lockdown in Lagos, Abuja and Ogun states by 14 days. Let's get the feel of the people.
I believe it's a very worthwhile decision that the president has taken to extend the lockdown. I believe if we adhere strictly to all the measures that have been put in place, we are going to achieve effective results.
So it's actually a good thing because he wants the country to be good. I guess for the health. Health is wealth. Without health, you can't do anything.
It's a matter of life and death. And if you see what is happening in other countries of the world, definitely as Nigerians, we should take everything seriously. And this fight of COVID-19 is not only government responsibilities. At our individual level, in our household, in our street, and everywhere we find ourselves, those protocols, those measures that government has ruled out, let us adhere to those protocols. That is the only thing that can save us.
This is one way to reduce the numbers, the casualty, the contact.
And in Kano State, towards preventing further spread of COVID-19, the state government has announced a one-week lockdown in the state. Now, this followed report of additional confirmed cases of the disease by the Nigeria Center for Disease Control, NCDC.
We appeal to you, let you observe this lockdown, complete lockdown for the next 7 days, starting from Thursday, 10 p.m.
And the Controller General of Nigeria Immigration Service, Mohammed Babandede, has tested negative for COVID-19 twice after self-isolation. A statement by the Service Public Relations Officer, DCI Sunday James, indicates that the CGI thanks all Nigerians for their prayers and well wishes during those trying times. He enjoins Nigerians to keep the faith and adhere strictly to medical and healthcare advisories, including social distancing, as well as safety, healthy practices of washing of the hands with soap and water, use of alcohol-based sanitizers, face masks, and every other professional advice for the good and well-being of everyone. And that ends the early morning news. To join me again here at 10 o'clock. For now, Kingsley and Kieran will be back in just a minute.
And the program is Good Morning Nigeria, and we thank you for your company. Next on the show today now is newspaper review.
Our newspaper reviewer, Baya Tobe, is here with us this morning. Baya, good morning and welcome.
Thank you, Kingsley. Good morning.
Yeah,
good
Baya,
morning,
you're welcome.
Thank you. Good morning, Nigeria.
Yeah.
Okay, so let's begin with the Daily Sun newspaper. Daily Sun, the earpiece just beside the nameplate says, Nigeria headed for worst recession in 30 years. And that's attributed to the IMF. And Buhari meets National Assembly leadership. Details of that story can be found on pages 2 and 6. And other COVID-19 related stories are as follows. Below the nameplate, court grants Caverton helicopters pilots and others bail. That's on page 5. Lockdown, that's the kicker. Anxiety as criminals and hoodlums terrorize Lagos and Ogun. And Inspector General of Police reads Riot Act and vows decisive action. You can see the president there and other senior government officials, along, of course, with some representatives of the EU delegation to Nigeria and ECOWAS. That was at the villa yesterday. COVID-19, Central Bank of Nigeria unfolds policy measures to save economy and businesses. That's page 25. EU boosts COVID-19 response with 21 billion naira grant, and UK to evacuate its nationals. Details on pages 6 and 25. Ex-Sosoliso airline chairman dies of coronavirus in London. And Lagos records 203 cases, 7 deaths, and discharges 70. Defense headquarters denies bombing civilians in Borno village. That's page 5.
Okay, let's turn to the Punch newspaper. The Punch for today are above the nameplate. IMF predicts worst depression. Nigeria's economy contracting by 3.4%. The story is on page 24. Amid coronavirus pandemic, Lassa fever kills 188 Nigerians. That's on page 29. 80,000 apply for CBN 50 billion naira COVID-19 intervention fund. It's also on page 24. Now, National Assembly leaders meet Buhari, seek SIP reforms. That was captured on page 11. Now, below the nameplate, we have the lead story. Federal government plans isolation centers at borders, 4,000 tests daily. It's on pages 2 and 6. Now, it has 4 riders to that. Government traces 9,029 contacts, conduct 7,000 coronavirus tests. Lagos uncovers 119 with symptoms in 2-day house-to-house search. LASG records 25 as cases jump to 373. Oyo to test 2,000. And of course, the picture story here is that of consignment carrying some medical supplies that landed in Nigeria to boost the fight against COVID-19. But below that, we have other stories. 6th anniversary, Zulum sends gifts to Chibok girls' parents. That's very thoughtful of him. It's on page 11. Autumn sacks Benue super boss over alleged fraud. It's on page 30. And then DHQ probes air strikes on civilians in Borno. That's according to Punch newspapers on page 30. Airlines bidding for evacuation of Nigerians in US and China. It's on page 9. Suspected killer of woman evangelists and 18 others paraded. Abductors of ex-Western State director's daughter nabbed. It's in pages 4 and 5. And of course, Tiv Jukun clashes. Benue, Taraba, OK troops deployment in boundaries. That was captured on page 10 of the Punch newspaper. Let's bring in Bayo now.
Yes, indeed, Kerian. All stories are dominated by COVID-19. There's a report about the donations by the United Nations of COVID-19 equipment that arrived at Nnamdi Azikiwe International Airport. The European Commission also brought in a donation of 50 million euro, which the paper is giving us 21 billion naira to the federal government. And in fact, they were emphatic about congratulating Mr. President about his nationwide broadcast, particularly with the indications and the emphasis on measures to tackle COVID-19. The International Monetary Fund also says that from the way we are going, COVID-19 is likely to cause a depression more than what happened in the what is described as the Great Depression. The Great Depression was a decline in the economy of the world between the year 1929 and 1932. At that point in time, the world economy declined by 76%. Now, from its spring meeting in Washington, D.C. yesterday, the IMF is projecting that, they are forecasting that the world economy will drop by about 3%. For sub-Saharan Africa, their projection is that there will be a drop of about 1.6%. This for the year 2020. Nigeria specifically is expected to have a contraction of about 3.4%. However, their projections still indicate that by next year, Nigeria is likely to rebound. That is, by the year 2021, Nigeria is likely to rebound by 2.4%. It's not only Nigeria that is affected. South Africa, that is already in a recession, is likely to suffer about 5.9% decline. But meanwhile, even the big industrial nations are also not left out. And the IMF notes that the economy of the United States, France, Italy, Spain, Germany, United Kingdom, Japan, Canada, all of which are suffering massively from COVID-19, will have a drop of about 6.1%. China, which was the nexus of the COVID-19, has suffered a drop of about 1.2%. And the prediction is that by next year, it is hoped that the Chinese economy, which is very resilient, will rise for about 9.2%. So those are the forecasts. However, in the area of situation or update, NCDC, about 9 p.m. yesterday, announced an increase in the coronavirus victims. They announced 19 new cases. By evening, by 11 p.m., the cases had risen to about 30. So far, we now have about 373 cases, 99 that have been discharged, so the active cases are about 371. On the issue of lockdown, 183 persons who violated the lockdown in Lagos have been taken to court and have been charged. 120 of them who pleaded guilty have been fined between ranges of 5,000 and 10,000, and they are also to suffer community service. The others who pleaded not guilty will return to the court to continue their trial. There were two magistrates who were sitting in mobile calls, and that is to tell you that the seriousness with the stay at home. A popular bishop who defied the social distance order in the United States, specifically in Virginia, has died of COVID-19. The pastor is known as Gerald Glenn. He said, as far as he's concerned, church service was a socially essential, and it was a social service, and therefore he went ahead with church service. The church, sadly, on March 22nd, was when he made the declaration that he will go ahead with the church service. On April 11th, the church sadly announced that he died of coronavirus. So the virus is very real. Mm-hmm. And we had a similar instance here in Nigeria. At Jos, a sheikh went and said that the coronavirus is false. It is the ruse by the Jews to fool people from prayers. In Katsina, the same thing. The police station was burned down. People were chanting, Malan Yache Ba Corona. And other reverends too in Abuja were stopped by the task force from continuing with the services. So the earlier we all took this serious, the better for all of us. And Lagos yesterday too had discovered 119 persons with coronavirus. How did they come about this? They have now embarked what they call a community search. They are doing this in specific areas where data has shown that there are concentration. And they have now gone to 118 households, and they have discovered about 119 persons with coronavirus. These are now to be subjected to test and monitored to ensure that it is really coronavirus, because the Commissioner of Health, Professor Abayame, has indicated that there are other respiratory illnesses that also mimic a coronavirus, but they will now have to test to be very sure.
So it's an indication that they are yet to be tested, or yes, that they have been tested, but the result is not yet out.
They have been designated and they are suspected.
They're still suspected because they have the symptoms that are usually associated with coronavirus. And I think what Lagos is doing is very significant because it's taking further advantage of the extension of the lockdown to take on this community active case search. Moving from house to house, to see persons who have the symptoms and therefore can seek them out. And then, of course, take the test, and when the results come, whoever is indicated as having coronavirus then is taken into an isolation center. I think that's very important, Kieran.
Exactly. All right, now let's go to the...
Kieran, just before I know you want to take the editorial, something Also happened yesterday. I'm sure we'll begin to see the ripple effect much later today and then the days going forward. President Donald Trump of the United States, some days earlier, had lashed out at the WHO, according to him, blaming WHO for, in his views, mismanaging the information regarding COVID-19. Yesterday, Donald Trump announced the suspension of U.S. funding of the WHO, and that takes instant effect. He says the U.S. spends annually 400 to 500 million U.S. dollars, and according to him, in comparison, China spends only $40 million. So what are the likely effects of this?
I don't think that his decision, will resonate positively among the nations of the world, because taking a unilateral decision, to disembark from contributing part of America's own contribution to WHO, for me, is very injurious, even to the fight against the COVID-19. Because we also recall that the initial time of COVID-19, that WHO made some reasonable announcements globally. In fact, even before they declared it a pandemic, has also even offered America some personal protective equipment, which of course Trump said America didn't need at that point in time.
As early as January 28th, his health expert warned him about coronavirus, but he dismissed saying this is the China virus.
And some intelligence reports as well, also through their own channel,
yes.
They fed the White House with information concerning the coronavirus, the dangerous nature of the virus. But at that level of governance in the U.S., they didn't believe that initially. It was when they now had the first the index cases. They had about 12, as the case may be, at the same time. That was when the government of America sat up. So for me, blaming WHO may not be the way forward.
Well, it's one thing to blame WHO. It's another thing to actually take the potentially injurious step of withholding funding. Because $400 million is a lot of money. Let's be realistic. It all reminds me of what happened a little over 35 years ago. You'll recall when there was a move towards a new World Information and Communication Order.
Yes.
Britain and the United States, particularly the US, led the move to deny UNESCO of funding on account of the New World and Information Communication Order that was being pursued. So UNESCO suffered for that for many years. Amadou Mataubo then was Director General of UNESCO. So how is this likely to affect WHO currently in its fight against or in its management of COVID-19 and indeed other infectious diseases going forward?
All right. Yeah. I want to believe that other nations will rise to education, perhaps increase their own contribution to WHO. Okay, let's go to the editorial, which is from the Leadership newspaper. COVID-19, no to mass community testing. I think the paper is saying that there is no need for mass testing of people. But we also know that one of the key elements in this fight against coronavirus is testing. As many tests as you can have will add to defeating the virus, because even overseas where the pandemic is more intense, there is this need. They always talk about the issue of extending tests to as many as possible. Yes, because by the time you begin to, the new cases begin to come down, that doesn't necessarily mean that people do not have it because they have not been tested. So he is saying, the paper is saying that it's not necessary for Nigeria to conduct a mass testing of coronavirus.
Well, one of the ways to combat the virus is to do tests, but you cannot do mass tests because the reagents you require and the cost for tests are very expensive. For instance, when it first started, for the whole of Nigeria, the reagents we have were only about 25,000. How are you going to apply 25,000 test kits to a population of about 200 million? And therefore, leadership is now saying that no to mass testing. But look at what Lagos is doing now. The area that have been proven by results to be endemic, they are now doing house to house, and that has yielded very, very positive result. They've been able to identify 119. But mass testing certainly is not advisable. And that is why the emphasis is on prevention. And how do you prevent it? Stay at home, avoid unnecessary contacts, If you observe distance, contact, and hygiene, that prevention certainly is better than cure.
Well, there's no possibility of testing everybody, as a matter of fact,
Yes.
But if there are areas that have been identified, as prone to that, especially where cases are coming from, perhaps there's nothing wrong in testing people in the area as many as possible, as much as possible, right? If you have the reagents you're talking about, because first and foremost, you have to have the equipment and the facilities to do that.
Lagos is doing something like that because they even provided a profile of the distribution of the area. For instance,
all right, but I mean the point you made is noted in terms of the sheer impossibility of testing an entire population. Those who manifest the symptoms, they are prime candidates for testing, and randomly you could also look out for those who are asymptomatic in terms of the infection. Bayo, thank you for being with us today.
Thank you
tomorrow. Okay. All right, it's Good Morning Nigeria, live on the network service of the NTA. We'll take a short break now. When we return, of course, we'll get ahead with our item for discussion.
And you're still watching Good Morning Nigeria on the network service of the NTA. Now, to set the mood for discussion on COVID-19 and essential workers, our correspondent Aisha Obali went out to speak to some essential workers and their challenges in fulfilling their duties during the lockdown.
Since the outbreak of COVID-19 in Nigeria, government has been trying to contain the virus, abruptly shutting down schools, aggressive hygiene campaigns, and daily briefings by the Presidential Task Force on COVID-19 to keep Nigerians well informed. Are some of the steps government has taken. The most difficult decision was the total lockdown in the FCT, Lagos, and Ogun states. The second broadcast by President Muhammadu Buhari stated clearly the need for an extension of the lockdown for another 2 weeks, despite the fact that activities in the FCT have come to a standstill. Essential workers like the frontline health workers, security personnel, and the media have continued to do their jobs despite the risk.
Really, it's the issue of fear which everybody has concerning COVID-19. Everybody knows, everybody reads, and you see them in the televisions. So these are the things that are making people to be so scary. Coming to work, you become so scared.
But the workload is more now. Now you see 2 people or 1 person doing the work for like 10 people. You are downloading. A supervisor like I am has to supervise for 2 weeks just alone. What you usually do in 3 shifts or 2 shifts, you are forced to do it alone for 2 weeks.
When they talk of palliative, there is no compensation in short. Each day I leave my home to be in the office, I don't always get myself because I'm always thinking of how my family will be coping and I'm endangering myself here.
So it has not really been easy, but by God's grace, we're trying our best to, do our work and make sure that Nigerians get the adequate information about COVID-19.
Can't blame the police because they have to do their job, and if you are not lucky to be at the back, you have to wait patiently till you get to your turn to even identify yourself who you are.
Some security agents who spoke off camera lamented the lack of cooperation from motorists who mostly claim to be uniformed men. However, with the total lockdown in the FCT and partial lockdown in most states, Mr. John is out with his whole family and seems to be ignorant of the stay-at-home directive, arriving Abuja and stranded at the Area 1 junction due to lack of vehicle to convey them to their final destination. Why are Nigerians who are not essential workers still out and about, despite government directive for them to stay at home? How challenging has it been for essential workers to carry out their duties in the lockdown situations? Guest on Good Morning Nigeria will be talking more about these issues and more very shortly.
All right, thank you very much, Aisha Obali, for that backgrounder. We incidentally have with us 2 of our correspondents, that's NTA correspondents. First, let's welcome Mitari Ikme. who covers the Presidential Task Force on COVID-19. Mr. Pleasure to have you with us on Good Morning Nigeria today.
Thank you. It's my pleasure, Kingsley.
All right. Also here with us is health correspondent Hakimat Aliyu, who is of NTA Channel 5. That's the local station for the Federal Capital Territory. Hakimat, pleasure to have you on the program.
It's good to be here too. Thanks for having me.
Okay.
All right, and also here in Abuja, but joining us via Skype is Assistant Commander General Felix Uke, Acting DCG, Crisis Management, Nigeria Security and Civil Defense Corps. We thank you for joining us this morning. Well, I hope that the line will be clear enough when we get started. And also via Skype is Bibio Bolomoye Joy Josiah, Chairman, Joint Health Sector Union, Johesu. Welcome to Good Morning Nigeria. All right, and moving on now, we also have Olabode Fadibe, Head Corporate Communication, Abuja Electricity Distribution Company. He is also via Skype here from Abuja. Good morning and welcome to the program.
Thank you very much for having me. Good morning, viewers.
Okay, it looks like Oyebode Fadibe's Skype is probably the clearest amongst the three we have. There's some distortion in the others. I hope they're able to sort out those distortions before we come back to them. I'm just wondering, Oyebode Fadibe, I mean, tell us what is happening in the power sector. I'm asking this question against the background of a video clip which I'm sure you also saw on the social media, because shortly after that video went viral, the Secretary of the Government of the Federation, who is also the chairman of Presidential Task Force, had it played on the desktop at a meeting he had with the big shots in the power sector. It was of a lady who was hysterical and yearning for electricity, saying, look, let there be light, let there be light. You are asking people to stay at home. People had made bulk purchases. Power was irregular. The things that the items they had in bulk storage were getting bad, and the generator noise and so on and so forth. Soon after that, it would appear that the quality of power supply tended to improve. Tell us something, Fadibe. I mean, we've had you on Good Morning Nigeria over time. Have you had to further deploy your men to ensure that there's steady power supply, and if so, at what cost?
Well, thank you very much, Mr. Kingsley Osadoro. First of all, say that I admire your sartorial elegance. I'm sorry for that distraction, but I just thought I should mention it. Thank you very much. The video that you mentioned, yes, I'm familiar with it. It went viral, and that video triggered the reaction of the Honorable Speaker of the House of Representatives and to hold a meeting with other key stakeholders. But of course, you remember that shortly before that video, the conversation in the power sector was that of the inadequacy of gas. Unfortunately, COVID-19 began to peak just about that period in Nigeria. So it was not surprising that that lady took to the social media to complain, because she had a legitimate fear that if we are going to sit at home, then how are we going to be able to cope? If we have to put food in the house, put food in the refrigerator, these are perishable items, how are we going to cope? But of course, you will also observe, and like you have rightly mentioned, that there has been a massive improvement in power supply. That is largely due to the fact that a lot of people have had to sit down at home as well, particularly major companies and things like that. You will observe that what we are seeing clearly now is a similitude of what we normally see during the Christmas period, when companies, particularly from 15th of December, when companies begin to reduce their operational activities and things like that. And I think it's a good omen for us that, I mean, Nigerians at home can have electricity. I know very clearly that all over the country, that improvement has been there, and that is also helping in the fight against this coronavirus because people can sit down at home. The weather is quite hot, particularly for those of us who are up north here. The weather is quite hot, and you really need electricity right now. And I want to thank God that the discos, particularly, as a matter of fact, the entire value chain is living up to its responsibility to provide electricity.
Well, I think I have to agree with you to a reasonable extent, because lately most parts of Abuja are now having what may be described as regular electricity at this period of lockdown. But of course, if you have to go into the further intricacies concerning the supply of power, that will be perhaps when we return to you on this conversation. But now let's come down to the studio where we have our professional colleagues who are also involved in essential duties. Let's begin with Hakimat Aliyu from NTA Abuja here, who is also a reporter covering health. Hakimat, tell us how it's been so far. There seems to be a paradigm shift, in the way we do our jobs, these days. And people like you who are also on the front line, from the media angle, we have to report to health. Invariably, it means you are talking to either medical personnel or you are talking to members of a COVID-19 task force, or perhaps if you have the opportunity of also talking to patients or those who have been, discharged. Let's share your experience, in this coverage since the lockdown started.
Okay, you agree with me. It's quite taxing. It's been quite a tax. It's not easy at the time like this going out there all around meeting these people. But critical to this fight of COVID-19, it's information, and we can't lay back on that. You need to get the people informed. So you have to go out there. You meet, like you said, medical doctors, those attending to these patients. You have to get information from them. You need to meet with the tax team too. In FCT, we have the emergency response team. They are those in charge of. We have contact tracing, the case management, and all that. These are people I had to communicate with to know what's going on, to bring the information to the public. So it hasn't been easy, but it's a tax and it's a tradition in NTA. You need to get the populace informed with what is going on.
How is this different from your regular beat reporting?
Wow, it's quite different because this is a critical time. We're talking about a virus which there's still some kind of uncertainty. People are still discovering about coronavirus. You can't say, you can never be too sure. So you have to apply. It's not the usual going out there to cover a report. You have to follow the guidelines. You need to do research on your own to find out what are the do's and don'ts. You have to protect yourself. So it's quite different.
Yeah, the key is research, because you have to have information before you can give it out.
Yes,
and
yes.
Especially when such information is already a clarified information that you can give to people. Because this circumstance of coronavirus, a lot of information is flying in the air, especially via social media. People make up stories.
welcome back, and extend good morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. We are right here in our Abuja headquarters studios. Some tweets have come in, and Kira and I will take those tweets now. And
medicines, face masks, food items, etc. They all need to be encouraged.
If you are a seller of these essential items, profit is your encouragement.
Exactly.
Kira, isn't it?
Exactly.
You are a chief and also a businessman. All right, Ridwan Bello tweets, on palliatives and hazard allowance, the word of journalists who bring us up to date with happenings around us. Please, the journalists too should not be exempted from these allowances as they are exposed to hazards.
All right, Akeju Olaboju, all workers are essential, but there are some workers that are under compulsion to report for duties due to necessity to render emergency services. Now, the use of essential workers can create disunity among public officials. There are emergency services providers, and we should also appreciate them.
That's fine. I mean, Kieran, part of the essential services that we listed while we're starting up this program, but the fire service. It's fairly easy to forget now that the Office of the Accountant General of the Federation went up in flames last week. The first video shots that came out expressed, quite some alarm that the fire was on. But within minutes, the Federal Fire Service was there, and they put out the fire. I mean, you could see the modern equipment that they deployed. The fire service, of course, are essential service workers. Exactly. And they are on duty 24/7. Steve Bond, 007, that's Stephen. Now, essential service workers should be well paid and insured because they have families to return to as well.
Then Demijel Sharon says they really need to be encouraged. They are risking their lives for us.
Fagun Roberts, with the number of victims treated and discharged so far, the health workers are doing pretty well and should be encouraged.
Now, Sarah B., the essential workers form the most important factor in the fight against COVID-19, but most of them are neglected and are exposed to all kinds of infectious diseases. The government should provide protective wears for them. 5,000 naira as hazard allowance health workers is too small.
Mike Ayako, essential workers are really the heroes of the fight against COVID-19. And these workers include doctors, nurses, lab attendants, etc. These individuals risk their lives in order to save thousands. Good job. Yeah. Governments at all levels must, as a matter of priority, duly accord recognition to them. So those are the tweets that we are taking in the meantime. I just, if we don't get any good signal from Johesu and the civil defense guests, we're returning to Fadikwe. Fadikwe, just before we go back to Johesu, assuming Johesu is clear, Fadikwe of AEDC, tell us something. Look, you ticked off some instances of CSR, that's corporate social responsibility, by a number of discos, including that of Abuja where you are. But the question arises because there's already a clear recognition of the fact that people are not working at this time. Those who are in formal regular employment may get their pay, but those who are self-employed on account of the lockdown, not just in the FCT, Lagos and Ogun, but of course in most parts of the country, would have some challenge actually raising funds. You did say that power is not on lockdown, and so estimated billing and indeed other forms of regular billing will not also be on lockdown. But is it possible to have a moratorium? Because we have seen what is playing out. I mean, some banks have sent out notices to say, look, if your ATM card has expired, that we've given it a new lease. You can use it for a while. The tax officers have also said that, look, you were supposed to have filed your returns by the end of March, but of course, there's going to be some grace period that you would get. Might this be an option to consider in terms of what's going on? Yes, people are happy to get power, but if there's no money in the pocket, you are bringing an estimated bill. What are you likely to get?
Because of a little bit of interferences here and there, I really didn't get the trend of the question. But I want to take a cue from your use of the word moratorium, and I want to presume that you are asking whether if customers cannot pay now, whether we can have a period of allowance where by the time the economy comes back to life fully, then they can be allowed to pay.
I think ordinarily there is nothing wrong with that. I don't think there's anyone that will pretend not to know what is going on right now. Admittedly, we are still sharing bills. Admittedly, we expect customers to pay. But when there are genuine cases of customers' inability to pay, I don't think anybody will put the whip on their back and say, oh, no, you must pay. I mean, because in the first instance, just like you rightly observed, coincidentally, the man's ATM may just have expired at that material time. It probably may not also be somebody who has that facility on his phone such that he can do transfer from his phone. But whatever it is, I think it will be on a case-by-case basis where there is a need to show humanitarian face. Of course, we will not go out there and say, no, you must pay. But I think this is a time that calls for everyone to use his conscience. If you can pay, please don't pretend. For instance, I know situations where some funny customers are even saying, don't bring bill here, you have COVID, you have COVID. All in an attempt to just, ward off people and say, and they don't want to accept their bill. This is a time that, just like somebody said, if they ask you to go and distribute food to those who don't have ability to provide it, and you steal the food, you are bringing cost upon yourself. I mean, this is a bit, how do I put it now, religious, but the fact remains that anyone who can pay, please pay. Don't pile up the debt. But for those who can genuinely not pay, remember that it is a debt that is deferred. We will still come for it, but because of the COVID-19, we can show that understanding.
When they call for it, there will be darkness.
Exactly. I'm even wondering how you can decipher between the person who can pay and the person who cannot pay. How do you arrive at that decision? But that's for another day. We've heard you that if you can pay, please pay. If you can, you have a way of assessing those who cannot pay at a particular point in time. Thank you so much. Let's see whether we can have a clear coach to speak with Joy Josiah once more of the Joint Health Sector Union, JOHESU. You've told us about the remuneration. You wanted a situation where there shouldn't be discrimination in terms of who gets what in this fight against coronavirus, especially for those on the front line. But now let's talk about the other challenges your people have on the front line. Talk about private protective equipment and other essential needs that they require in this fight. Are they sharing any of the opinions with you concerning what are seen on the front line and how you can bring a kind of remedial measures to address that?
Thank you. With regards to the PPEs and the other needs, I think in the isolation centers, especially the reports we are getting, the federal government has tried relatively well. But what we are talking about in states and other health institutions, we have been getting a not very fair report. And that's why we are calling that the concentration should not be any provision that is to be made in terms of health provisions should not be concentrated only at the isolation centers or at detected or confirmed. We should also, while giving attention to the isolation centers and impacted states, let us also look at how we can use this avenue to prop up the abilities or the capabilities of other health institutions that are yet to be impacted. Because if we wait for it to come before we go in, we will be losing so much ground. And these are things we've been crying out for the past, for many years. Sometimes when we try to draw government attention by saying, okay, we have waited for 6 months, promises have been made, nothing has been done, and we are going on strike to draw government attention. Our people are even punished for trying to say the health system, there are problems with the health system. Thank God COVID-19 has come. Everybody is now bearing with us that, yes, we made genuine calls. Having said that, I want to still say that our members, right now as I speak, as head of GSU, we have a situation where we get information from all corners. Our members' morale, because in this fight, one of the key things is motivation. And the morale of the health workers, or every other essential service worker even, must be put on a higher pedestal, so that the risk they are taking will not be the prime thing they think about. They should be thinking about the country first. When the country is motivating them adequately, they will also say, okay, it is worth dying for this country. Like, there is no hazard allowance, like I said, that will be enough to replace anybody's life. So we should be really, really careful. Like the journalists, I want to thank you because you've been making a lot of statements to see how health workers can be cared for. And I want to thank Nigerians for showing so much concern about the need to care for health workers. But I want to say that, for instance, one of the things that I told you about a red flag, another red flag I'm telling you is this. There was a time we genuinely embarked on a strike on 2018, calling for better health services, better equipment, and better care, and all that, and including welfare. And our people were punished after we were denied the promise made to us for 92 days. Then we embarked on the strike. After we were denied 6 months, and then we embarked on the strike. And April, May salary was withheld. Our members are saying, even during the Civil War, after the bombings and killings, that everybody was vexed, yet the head of state at that time came out to say, no victor, no vanquished. And everybody, that's why we were able to reconcile ourselves to this point now that we are now still in this very beautiful Nigeria. So I want to say.
All right, Josiah, thank you very much, Chairman, Joint Health Sector Union. I would like to thank you for being with us, at least in the latter part of the conversation. The Skype connection was pretty good. We also would like to thank the Acting Deputy Commandant General of Civil Defenses in charge of crisis management, Felix. Okay, unfortunately, the Skype connection wasn't good. We hope that will be rectified some other time when we do have the opportunity of inviting you to be with us on the program. Oyebode Fadikwe, Head Corporate Communications of Abuja Disco. Always a delight having you on Good Morning Nigeria. Thank you very much. And let the power supply continue, not just in Abuja, but also inform your other colleagues in other discos. And here with us in the studios, our colleagues, Hakimat Aliyu, who is a health correspondent of NTA Channel 5 in Abuja. Hakimat, thank you very much for being with us.
It's my pleasure. I would say the producer has really done well with this particular episode, beaming lights on the essential service providers at this time, because when you say essential, the health workers enjoy more acknowledgement to this, but this has brought more light to other essential workers. You hear the tweets. A lot of people have spoken for us. I'm sure journalists out there will be particularly happy with this episode, and hopefully
are you advocating for any remuneration for?
If something is being done, I'm sure we'll be delighted.
and if I may ask, it cannot be too much for journalists to also be included in the hazard allowance package, because when this whole COVID-19 pandemic came about, journalists also went into panic buying. And when you go into panic buying, it's not like your usual shopping. You shop as if you don't know what's going to happen. You shop with authenticity. So it would not be out of place if we have this hazard allowance, because even there's a burden of expectations from the family, from people out there who see you on television, people who hear you on radio, and who see your bylines in the newspaper.
So we can be included as well.
Yeah, Kieran and I will expect